All right, Doc, if you were to describe yourself in 3 words, what would they be and why?
Passionate, stubborn, um, and that's a tough one. What's the third? Committed.
Awesome.
Yeah.
Like it. Okay. Doc, what do you know about our organization here at Supreme and the patients in our care, clients? What type of relationships have you met and created so far?
I think the beauty of a health and wellness organization or offering is that you have people who are really committed to helping themselves. You have patients who are looking for alternatives to what traditional Western medicine has offered, at least in the United States, which tends to be much more reactive than proactive. And so to have the opportunity to help somebody find their path to healthiness and happiness is a privilege and something that I certainly cherish in my role here.
So, Doc, what interests you in working in the industry that you do? Was there any certain thing that happened at a younger age that kind of brought you into this uprising? Was it anybody in your family? A little background on that.
Yeah, I mean, there are healthcare people in the family, but I think as I was going through school, I realized that the sciences and math and things that were that sort of were the things that posed challenges to me and that I found a natural enthusiasm around. And I always loved the opportunity to help in any situation that I could, at being a problem solver or at least being a partner in finding solutions. And I think it just is one of those things that just naturally resonated for me. I don't know if there was not one specific moment or epiphany that I had in life that drew me to this, but there's not a day that goes by where I'm not certain that this has been my chosen path.
So, Doc, what are your greatest strengths?
How do you brag about yourself without sounding like you're bragging? Well, I think the sort of the descriptors I gave you earlier about being, passionate and committed and stubborn go a long way in drilling down and finding answers, especially when in the practice of patient care, you're frequently posed with obstacles or barriers to the end that you want, and I've never taken no for an answer, and I think that's what has provided for the success that I have. I'm very committed to my patients and the care that I give, and when people talk about how business is business and it's not personal, I've never understood that because who I am professionally is very much who I am personally and vice versa. There is no separation, and what you see in the professional arena is what you see in my personal arena. I'm the same person. And I think it's that sense of genuineness that I hope resonates with patients, that provides that sense of credibility and trust. I think I have the ability to establish a quick rapport and connection with patients, and that goes a long way into creating that sort of necessary collaborative partnership in any relationship that helps provide for the greatest success. And I think my ability to connect with patients and engender that trust goes a long way to whatever successes I've appreciated in my career.
So, Doc, do you stay up to date on current events in the medical and healthcare industries? And if so, how do you?
Yeah, I mean, I still practice clinically, formally. and work very closely with our residency program. So there's constant education and challenge from the next generation coming up, which is an awesome responsibility, but and also an awesome benefit to be able to have that challenge and constantly being fed updates just through the natural course of being part of a training program. And then, between what is required of me to maintain board accreditation, continuing medical education, there's many routes to maintaining, currency and what it is that that I and we do. And then I have, my own natural curiosities about certain things, particularly when I'm presented with a unique patient or a unique presentation that will drive me just naturally to want to learn more, brush up on where I am. But doing whatever we do professionally is sort of a constant process improvement, if you will, at least for those of us who I think who are committed to our trade. So we're never content with who we are or where we are professionally, and I hope that comes across in the care of my patients too.
So, Doc, what is one goal that you would like to accomplish in the next year?
I would love to see the realization of the combined commitment and passion that we at Supreme have put into what it is that we do. There are a ton of smart people here from a milieu backgrounds, and all equally committed and complementary to the care we provide our patients. But what people don't see is everything that led up to this. All the hard labor, all the successes and the mistakes that result in the culmination of what I think is a tremendous service and a tremendous offering for our patients, any prospective patients. And I just hope that in the next year we're able to realize that because I know it can benefit anybody that walks through the front door. Is this you?
No.
Is this Steve?
Yeah.
Steve!
Yeah.
Turn that shit off.
You hear it? Sorry.
All right, Doc, where do you see yourself in 5 to 10 years?
Hopefully alive. Man plans, God laughs. I'm beyond planning, other than just to be healthy, happy, and contributing partner in everything that I do. Every day is a blessing, and I hope that I can live by the same words and credo that I offer my patients in living well, being well, and taking care of themselves, not just for their own well-being, but again, to be active in the relationships that they are in, whether it's a parent or spouse or brother, sister, or family member, and to create the opportunity to have more opportunity. So I don't have a specific goal other than just to be the most of who I can be in whatever relationship or venture that I'm in. It's a fucking cop-out, but it's okay.
That's good. All right, Doc, so what do you like most about practicing medicine and why?
I don't know if there's one thing that I enjoy most. I think, first of all, it's a privilege to be able to be a part of the patient-provider relationship. It's humbling, it's challenging, and it's one that I take very seriously. Thank God you can cut all this shit out.
Yeah, sorry. It's all good. We can move on to the next one.
No. I mean, there's something I want to say, and it's right there, but...
The questions are pretty similar, so let me see if this next one. So what aspects of practicing medicine do you find most challenging, and why? Or anything that you find that you're very good at?
Yeah, well, I think, the relationship piece, I think, is critically important, and it's the sort of soft skills that in any profession, but certainly in medicine, are what can make and break a successful partnership with a patient and patient care. I'd like to think that I've got a personality that can put patients at ease, that can make them feel comfortable, that can make them feel confident in my care for them and my concern for them, that I can establish a good rapport and a very easy line of communication that facilitates the success that we both want to have in what it is that we're looking for. And I tell my patients, this isn't a me relationship, this is a we relationship. And I can provide all the guidance that I want, but at some point you have to be able to trust and have faith in what it is that I and we offer at Supreme, and have the ability to have that communication so that we can tailor it for what it is that you need uniquely.
Great answer. So, Doc, you got a certain philosophy with medicine and how you treat patients? I know these questions are kind of similar.
Yeah, I mean, no, it's a good question. It's a very good question. I think, again, people have, I think people can have whatever academic or professional successes that you can objectify based on a CV or a resume, but I think what really, again, separates good from better providers is that ability to communicate, that sort of, those soft skills. And again, for me, it's important to come across as someone who can be credible and trusted and collaborative, and can establish that, again, that rapport that provides for that best possible outcome. But my philosophy is I would never recommend anything or do anything in your care that I wouldn't do for my own family member. And as I've said before, when people try to separate the business from the personal side and saying it's just business, I don't understand that, because everything I do is personal. My role as a provider, as a doctor, is extremely personal to me, and my care to you is extremely personal to me, because I'm putting in everything that I am into the best possible outcome and best possible recommendations when I'm with my patients. And I really hope that comes across as genuine and true, because it is.
So, Doc, can you tell me about a time that you disagreed with another physician, and how did you handle that situation?
It happens occasionally. I think this is, most of the time, those sort of potential conflicts can be overcome through reasonable dialogue and communication and patient perspective management. But while there's no one specific case that I can give you, I can tell you that I will always advocate for my patients. And while I'm very confident in what it is that I do and my capabilities and skills, I approach it with a great deal of humility, knowing that I'm as fallible as anybody else, and certainly patients can present in different ways, but when I'm confident in the care that I'm rendering, and I believe that there's some misunderstanding by another practitioner providing care, I am an advocate for my patients, and I will stand up for what I believe is right and appropriate in their care, until proven otherwise.
So, Doc, how do you go about approaching or discussing unpleasant topics with a patient or their families?
Yeah, I think that goes back again to those sort of soft skills and that ability to be the human being that we all are, and having the ability to feel true empathy. We've all been in situations where we've been pained or hurt or disappointed or in some way emotionally, spiritually, devastated in some way, or at least put in challenging positions. And I think I will funnel those experiences in my approach to my conversations and care with patients. And again, I think it takes a good balance between sincerity, empathy, and honesty, that you can have those difficult situations, but be straightforward. And I think most people want to hear direct information, without a lot of the sort of subjective fluff that sometimes can go into this. But I think that you can have difficult conversations and be sympathetic and be sincere, while respecting the need for patients to hear what it is that they need to hear.
Awesome.
Yeah, how would I want to hear it?
Mm.
I don't think I'm any more or less human than anybody else that I take care of, so just try to approach it from how I would expect someone to speak to me during a difficult conversation.
This is an interesting one.
Yeah.
So, Doc, what do you do if you have a patient who complains of symptoms, but you cannot find a cause right away? Or if you don't have an answer right away for that? What's kind of like your system around that?
Yeah, I mean, I think it kind of depends on my perception of the acuity or immediacy of what's going on. It's not unusual. I mean, as an emergency medicine provider, my job is to triage sick from not sick. Sometimes you know that right away. Sometimes it takes a little bit of discovery and investigation through testing of whatever that is. And there are a lot of times when I don't find an answer other than to firmly believe, based on clinical intuition and experience and objective data derived through the evaluation of patient care, that this isn't something necessarily serious. But that doesn't mean it's not serious to the person I'm taking care of. And so I think it's important to respect every patient's sense of autonomy and self-awareness, without being dismissive, but also trying to provide that professional perspective and reassurance that while we may not have figured it out now, I'm still committed to finding a solution for you. And that may take time, that may take additional resources through additional consultations or testing. But in the end, I'm with you in this path, and I'll be honest and candid with you through its entirety, and I'm while still being committed to finding a solution for you.
Nice. All right, Doc. So what changes or improvements has Let me see, word this a little better. Skip. All right, let's. I'm gonna word some of these questions. Let's try and guide them towards Supreme now.
Sure.
Let's just kind of force them into it.
All right.
Let me get a reset here. All right, Doc. So, do you got any specific or favorite modalities that Supreme offers, and any one that you suggest to people more than the others?
I don't know if there's one that I recommend more than the others. I think any given patient can find a benefit from one or several of our different offerings. If you're asking me personally, I find a ton of value in sort of the anti-inflammatory, antioxidant modalities. I love the hyperbaric chamber. I still trying to keep up with my bazillions of kids, try to stay young and fit, and as we get sorry. Anyway, trying to keep up with 4 kids is always a challenge, and so I still work out regularly. But the older you get, those workouts tend to have a little more impact or hangover, if you will, physically. And I find a ton of value in sort of the re-energizing that the hyperbaric chamber offers. And I'm not afraid to cheat a little bit too, so I love the M-Sculpt. So while I am a huge fan of core, and I do a ton of core to protect my back and maintain my strength, there's no doubt that the M-Sculpt is sort of a fast track to improving core strength and getting rid of a little bit of that extra fluff that inevitably gets to you once you get over the age of 35 or 40. So those are 2 of my favorites.
Awesome. Good. All right, so docs, as far as IVs go, what's your input on that? Do you have a favorite IV? Do you do IVs? Do you prescribe them? And what do you think the industry and how IVs have affected the industry, and what's your thoughts on all that?
Yeah, I think that the idea of the general wellness industry, but particularly here at Supreme, is that, again, we're trying to set up our clients for success by being proactive, not reactive. And the IVs, while offering both, I think are an excellent modality to providing health, to maintaining health, whether it's vitamin supplementation, whether it's an energy infusion, whether it's a vitamin D. There are tremendous benefits to everything we offer that are medically founded in sound science, and it just depends upon the individual and what they're looking to achieve in that moment.
All right, Doc, we got, if we're looking outside right now, sun is shining. Would you prescribe? How you doing?
Hey, how are you?
Okay.
All right, Doc, so sun is shining today. Would you prescribe somebody to go outside, get natural sun rays versus, let's say, red light therapy that we have at Supreme? Or is it all of the above, this and that? What's your thoughts on those?
Again, every patient's different. There's certainly something to natural sunlight and the outdoors and fresh air that's rejuvenating on many levels, whether it's physical, emotional, psychological. But there's no doubt that our directed UV light therapy can improve a sense of well-being, a sense of physical health, sense of mental health, and clarity that while you certainly can get on the outside, this is a great supplement, and certainly in the dark, long months of Chicago winters, which seem to be lasting more than 6 months these days, are a tremendous adjunct to that and maintaining health through some of the colder, more indoor-oriented times of Chicago year.
That was good. I like how you
thanks.
pulled that into
Thanks.
Chicago winters. People are like, oh yeah, Chicago winter. I'm going to get
Yeah.
That's good. All right, Doc. Electrical stimulation. Have you messed around with it a lot? What do you think on that as far as your patients, as far as muscular recovery, and a lot of those aspects of what electrical stim can do for you?
Yeah, again, going back to the fact that we create individual solutions for individual patients. Not everyone will benefit from that necessarily, but I can tell you that in a handful of patients who we've been presented with extremely challenging clinical situations, like Otis Wilson, who was recovering from a stroke and had apparently met the limits of what traditional insurance-funded rehab was offering him, and still was not content with where he had recovered. Our muscle stimulation helped him tremendously to accomplish what may seem like a small goal for many in swinging a golf club and returning to casual golf with his friends on a regular basis. It was something that was everything to him in returning to a sense of normalcy. And it was that muscle stimulation therapy as part of our entire care offering to him that I think was the big difference in his success and his now being back on the golf course, swinging the golf club, and being active in life once again and where he wanted to be.
Thanks. Doc, so do you ever just get some time to relax? I know you got the kids, the family, the busy life. Do you ever hop on, the float tank or any of those kind of things? What aspects of those do you enjoy?
Yeah, one of the advantages of being medical director of a wellness center is that I get the opportunity to take advantage of all our offerings, and I think they're all tremendous. There's no doubt for me that the float tank is something that provides almost an instantaneous sense of calm and relaxation, and I find incredibly therapeutic, just for returning to some degree of sanity after a long or stressful day. And two, I love the hyperbaric chamber. While I think the anti-inflammatory benefits are fantastic, the idea of necessarily being captured for an hour or two in some place and not having to be bothered is also sort of a tremendous side effect of using our decompression chamber. The hyperbaric chamber.
Yeah, it's all right. I know, and I think we called it like the float tank, but really it's like a float bed.
Yeah, same thing.
What else? There's the Hocket. Let's see. Have you experienced with the Hocket at all?
Yeah,
Okay.
I haven't done it like a ton of times. I've done it like twice, I think.
Gotcha. So
It's sort of the ozone therapy that I think that he wants to talk about, but I want to get the talking points from those guys before I go too far into it.
okay, gotcha.
It's just another antioxidant therapy, but they've probably got some points they want to talk about.
Gotcha.
Yeah.
Okay. Let's see. I want to see let's word something to where we're really just trying to pull somebody through the door. Like, say something just like something about like me knowing all that, like having a lot of knowledge compared to like the rest of, without sounding kind of like weird.
Arrogant.
Yes.
Yeah.
But like, there's nothing more that I could suggest to implement into somebody's lifestyle than using like these type of modalities,
Yeah,
something like
yeah.
that nature. So Doc, let's say going into these next 6 months, we're working our way into fall and winter right now. What do you suggest is the best route for somebody to take right now if they wanted to start improving their lifestyle and to start living supreme?
Well, I think the best opportunity is just come and have a conversation with us. This is, again, a healthcare environment, and we are very focused on you as an individual. So even if it's just curiosity about what it is that we offer, who we are as individuals, and trying to see if what it is that we're offering and who we are as individuals fits with who you are and what you're looking for, please come just see us and have a conversation. There's no pressure at all. We want you to be an active participant in this, not feel under any sort of pressure or duress that you need to be committed to something. We want to find a good balance for you and what fits you uniquely in your goals. But I think coming and having a conversation is the best way, at least to initiate, the opportunity for you to realize what it really is that you're looking to accomplish. Chicago winters provide a long amount of downtime, and we can sometimes get a little bit complacent in our healthcare. But I think this is an opportunity as we're getting out of those active months and into sort of the longer, darker months, to help establish a goal for yourself. And we have a ton of opportunity and modalities to offer and customize for you as an individual patient. So, and pause.
That was good. Good. All right, Doc, any final words for the people that you'd like to throw in there?
I think the best thing about being part of Supreme and being a partner with Dominique and Steve is that there's so much passion that drives what it is that we do, coming from multiple different perspectives and experiences in the healthcare industry, but all focused on a singular goal, on improving the lives of our patients. And we realize it's not a one-size-fits-all. And that's why we're here to listen to our patients, to be able to establish that rapport and develop that relationship that will provide the best opportunity for you to realize what it is that you want in whatever way that ends up being. And it's really a privilege to be part of what we don't really experience in traditional American medicine. It tends to be way more reactive, but to have the opportunity to be proactive and help put people in positions to be as healthy as they can be, to have them make the most out of life through that healthiness, and to give them the opportunity to realize what it means to live supreme.
Beautiful.